Close to 500 general practitioners have gone through training to diagnose and treat mental health patients as Singapore seeks to build an extensive support network around the community. And this is part of a national strategy launched in 2023. It is also seeing more polyclinics equipped to deliver mental health services. Alivamsha reports.
Walk into this exhibition space and you'll find unique artwork from 12 youths. But there's a common thread running through them: how cultural and childhood experiences have shaped their mental well-being. It's an ongoing effort by the Singapore Association for Mental Health to cast light on the issue.
They went through 3 months of art making process, facilitated by our One Art Therapy and a program executive who is trained in art, and they try to access their memories, how they have gone through their childhood, and they came up with the various art modalities to express themselves.
On top of such showcases, this centre, nestled in a Jalan Besar housing estate, offers a slew of mental wellness services.
We do a lot of community education, and when we do outreach, we actually share our helpline. If they need to receive counselling, we invite them to our centre for counselling, and we also provide hybrid counselling where sometimes it could be over virtual or customer can be on site. And also we try to make it accessible to people by if they find that coming to our centre is a little far, we have other centres around Singapore where we can make appointment for them to see us there.
Efforts like these are gaining momentum amid Singapore's push to make mental well-being a national priority. Today, nearly 500 GPs are trained to handle patients with mental health issues. By 2030, the goal is to have all family doctors under Singapore's Healthier SG preventive care program do the same. One GP says by bringing these services closer to people's homes, they'll get to seek help quicker with less worries.
When the patients with mental health comes in to seek help, they don't feel the stigma because, these are all people who are coming to report sick for all sorts of ailments, as opposed to maybe Institute of Mental Health, where you tell the taxi driver, bring me to Institute of Mental Health, immediately the stigma will be there because the taxi driver may look at you, oh, so you got mental health issues, right?
Similarly, 22 of Singapore's 26 polyclinics are equipped to handle mental health patients. By 2030, all polyclinics will be able to do so. At National University polyclinics, for example, specially trained nurses called care managers will help identify and diagnose patients with mental health issues.
Right now, at this moment, we can only train a group of care managers who had the special interest in mental health. So moving on, we are actually looking into expanding this further to eventually train all our care managers to be able to provide such mental health services in the future as well.
Plus, seniors at risk of developing mental health conditions can turn to community outreach teams for support. The aim is to raise the number of such teams from 75 to 90 by 2030.
At least 1 in 7 Singaporeans have experienced what may be termed mental illness. So as the country makes mental health a national priority, let's take a look at some of the common mental health issues Singaporeans face. Number 1 on the list is major depressive disorder. Close to 1 in 15 have faced this mental illness in Singapore. Also known as clinical depression, it is the most severe form of it. And one experiences extremely low mood for a long time, losing interest in usual activities, and left untreated, it is a top risk factor for suicide. Next, extreme mood swings or bipolar disorder. One moment feeling extremely excited and happy, but next, after the high, comes the low. 1.6% of adults here are thought to suffer from it. It can be treated with medication, but support is also key. Know someone who often seems to worry out of proportion? They may have generalized anxiety disorder. It develops gradually, often starting from childhood. The heightened anxiety can interfere with their lives and the choices they make. Next, Obsessive compulsive disorder sufferers feel driven to do compulsive acts to ease their stress. Thoughts or urges keep coming back, and it leads one to act based on ritual. Now, for example, cleaning excessively or checking things over and over. And lastly, alcohol use disorder. One can't stop drinking, even at the expense of health. Alcohol is used to deal with stress, and studies say more people struggle with it in Singapore, but they are seeking help earlier. Now, for more on this, we speak now to Associate Professor Swapna Verma, Chairman of the Medical Board at the Institute of Mental Health. Professor Swapna, thank you so much for joining us tonight.
Thank you for having me.
So, as we know, Singapore has set out this national strategy in 2023 to provide better support for mental health and well-being to Singaporeans. How are we doing so far, in your view?
I think this strategy is definitely a step in the right direction because it moves from focusing on patients with serious mental illness to more upstream, focusing on prevention, early detection, and intervention. It also makes care more accessible to people right near their community through primary care, through social service agencies.
So at least we were looking at that survey earlier, at least 1 in 7 Singaporeans has experienced what may be termed mental illness. How does this figure compare with other countries?
So globally, there has been a concern about rising prevalence of mental illness, especially post-COVID. In fact, we were expecting a mental illness tsunami, which hasn't happened, luckily. We have seen an increased prevalence in certain age groups, such as the young. But this study, which quotes 1 in 7, is a 2016 Singapore mental health study. And Singapore kind of compares fairly against other countries who have used similar methodology. We are comparable. Yeah.
And we are seeing more GPs and polyclinics in Singapore providing mental health treatments, being more equipped to treat our patients. Is this able to bring down the numbers, though?
What it will do is by making care more accessible and convenient to people, people will seek help early, and that would prevent their condition from deteriorating or becoming more serious. So I think that will really help in preventing further deterioration, preventing people from needing hospitalization or specialist care.
So what needs to be done to bring down the numbers?
Then for that, we need to focus on prevention. And mental illness, it's multifactorial. We use the stress vulnerability model. So some of it is due to genes, but some of it, like some of the other risk factors, are early childhood adverse events, obstetric complications, exposure to substances later in life, like cannabis or even alcohol. So those things, if we focus on that, and that can bring down the rates, especially early childhood events. That has higher, people who face that are more at risk of developing mental illness.
And we are looking at the top 5 mental disorders here. Are there some on that list which are more serious than others? Can you take us through what you are seeing in your clinical practice?
Actually, all the 5 disorders that you mentioned, they all sit on a spectrum. So even for somebody, you said clinical depression can range from mild to serious. OCD also, you can have very mild symptoms to serious symptoms. One condition which was not in the list, but we do see that as a number 1 condition that we see in the Institute of Mental Health, because it's a tertiary care center, is schizophrenia or psychotic disorder. It starts in the late teens, early 20s, and it's a chronic condition. But even over here, because that's my personal special interest, and we see young people with first episode psychosis, and I've seen that early intervention makes a big difference to recovery.
How do we help these people have early treatment for their conditions, Professor Swapna?
It's raising awareness, training gatekeepers, so training teachers, counselors, community workers, improving mental health literacy in young people, with parents, so that they are aware of the early signs and symptoms and seek help early.
So it's about creating the awareness, but a survey suggests that nearly 90% of Singapore employees, this is in the workplaces, they wouldn't seek help for a mental health condition due to stigma, of course. Why is the stigma of treatment for mental health problems such a big issue here in Singapore?
I wouldn't say it is just unique to Singapore, but yes, I do feel it's more in Asian countries.
Yeah.
There are a lot of misconceptions about mental illness. People still sometimes view it as a personal weakness, or they feel that patients with mental illness are dangerous, and there's social distancing. That creates a lot of stigma. And the person with mental illness then worries about how society views him or her and delays seeking help. And the stigma is real. They have faced problems in the past.
So what can we do as a society to address that?
I think the most important thing is equipping ourselves with information and knowledge of mental illness. Because with that knowledge comes understanding, deeper understanding, and accepting. Similar to COVID, I think initially when COVID started, people were very scared and stayed away from people who had COVID. But with more knowledge about the illness, everybody rushed in to help. So that would really help. I think people with mental illness, we need a society that has more in mental health literacy and then becomes more understanding and more inclusive.
So it's really about reaching out to the people around us and providing help to them when they need one. Okay,
Yes.
Professor Swapna, thank you very much for speaking to us tonight.
Thank you.
That was Associate Professor Swapna Verma, Chairman of the Medical Board at IMH.